my name is Samantha Buck. I am a pharmacist. I work and I own Embrace Pharmacy in Grand Forks. I have a PharmD, which I got at NDSU in Fargo. So a little bit about Embrace Pharmacy. My husband and I opened it up about 3.5 years ago after I graduated from NDSU. My schooling consisted of doing pre-pharmacy at NDSU and then going to NDSU for the pharmacy program, which is 4 years. So my total schooling was 6 years. Now it's more 7 or 8, just depending on the school and your prerequisites and what you go into school with. And now a lot of schools have a fast track program that kind of gets you from high school into the program a little faster, just so that you're not in school for so long accumulating student loans. What brought me originally into the profession of pharmacy is my whole entire family does healthcare of some sort, and so I knew that's what I wanted to do. I just didn't know what. So I job shadowed quite a bit. I job shadowed a nurse, a doctor, a pharmacist, and the pharmacist is what just stuck out to me. I felt drawn to what they were doing, how they helped patients, how they interacted with people, the math and science behind it, and that's kind of what drew me in there. As I progressed through the field, it really connected for me to realize that that's what I wanted to do. I like helping patients. I talk a lot, and so it is a perfect fit for me. Some of the things that we do throughout the day, as a pharmacist, as an owner, I do a lot more than I would do as just a pharmacist. As an owner, making sure that everything is running smoothly in the pharmacy. As a pharmacist, entering in prescriptions, checking prescriptions, checking drug interactions are big things. A lot of softwares do it, but a lot of softwares, don't necessarily give you the whys and to find out if it's a valid drug interaction or if it's just something we need to be cautious of. And then counseling patients, helping patients with questions, problems, when to take medications, with or without food, what times of days, what they should be taken with or not with. Those are big things, and it's a lot of just helping patients take their medications appropriately. I also give immunizations. So during this time of year, we give immunizations every day, all of the time. We go over patients' medication history and their drug lists. So it's called a medication review. We do quite a few of those, just making sure that patients aren't having side effects that they shouldn't be having with the medication, that they didn't know was because of a medication, and making sure they're taking it at the right time, to make the medication the most effective. And so there's tips and tricks that we can help patients to remember to take pills on time, to understand why they should take medications. A lot of patients want to know whys. If they don't understand the whys, then it's kind of not as important to them to take the medications like they should. Some of the things that I love doing as a pharmacist I absolutely love helping people. I love seeing people grow, seeing people get better. I like helping, financially find the best solution for people. I like making a judgment-free zone for people to come and get healthy. That's my goal. And I like connecting with my patients. I like knowing about their days. I like knowing who they are. I like knowing their family. I like being able to call their name when they come into the doors, say hi, and welcome them. It makes a big difference. You feel like family, and I kind of treat all my patients a little bit like family. What I would say I don't like about pharmacy, more or less, is the hours. When you get into pharmacy, it's a great field, but it is retail. And so there's nights, there's weekends, there's holidays. Pharmacy never ends. So it's a job. It's like, nursing. You work, pharmacists work around the clock. So whatever job you have, you work around the clock. You also work retail. So it's customer service, which is good and bad. You have both aspects of customer service anywhere you go. Majority of it is good. So you have to focus on the good and not the bad, but it does come along with both aspects of that. What I would tell you from going from high school to pharmacy school is do job shadows, follow people, know what you're doing. Also, do your math and your science. Know your bases of math and science. It is critical to have the base knowledge. Not only do you use it a lot of the times during the day, even here now, but it helps you understand the why drugs work, the how drugs work, the body, anatomy is huge. You use math every day, so those are two things that you want to probably be familiar with. You also do a lot of writing, and you do a lot of talking, so those are things that you have to be comfortable with. There are fields in pharmacy where those aren't as prevalent, that you could get into if you really like the science part, but just those are not your forte. So how the pharmacy works here is how a retail pharmacy works, I should say, is it's more so a big open area. We have lots of workstations. We all work together. It's a group effort every day. Is to entering prescriptions, filling prescriptions, checking prescriptions, ringing people out, getting shots ready, putting the order away. It's a whole process. It's a flowing, dynamic movement of people every day. So for the most part, you're never alone. You never do anything by yourself, so you always have somebody to bounce ideas off of, to work next to be around. You're extremely active for most of the day. You're standing, you're moving, you're running sometimes. You're always up doing something. Majority of pharmacists or pharm techs probably don't sit in a day. Sometimes if you're at a workstation for long periods of time, you'll grab a chair, but most of the time you're standing. So it has to be a career that you're active, you're moving, and you're prepared to kind of be standing on your feet and moving around all day. When you get done with pharmacy school, there are a couple different routes you can go. There is retail pharmacy, you can do hospital pharmacy, you can do research, or there are residencies that you can do. Residencies are going to try to advance you into specialty fields of pharmacy. A lot of in-hospital pharmacists now require you to have a residency behind you. It gives you backgrounds on different medications or different settings. There's specialties in like a peds pharmacist who just does peds dosing. There's oncologist pharmacists who just do oncology dosing. There are nuclear pharmacists who have specialized equipment and do specialized radioactive medication that you only can do certain hours a week. They have a lot of different protocols behind them. They don't necessarily need to do a residency, but they have a lot more training that they go through. But residency is basically going to be very similar to medical school, where you do 1 or 2 years of a specialized field before you go into the practice of pharmacy. Some places are moving towards that. I would say probably about 50% of people do or do not do one, but you're looking at another 2 years of schooling after that, so you'll have 7 to 8 years of pharmacy school plus 2 years onto that. And there's pros and cons of it. It is to each their own, kind of depending on what you want to do when you get done with pharmacy school. Most pharmacists are going to start out probably making about $50 an hour. Once you get into the field and you start practicing a little bit more, I would say the average is probably going to be about $65 an hour, whether you're salaried or not, just depending on where you work, how many hours you work, if you're full-time, part-time, but that's going to be the average. As you progress, as you are in pharmacy longer, that goes up pretty drastically. In North Dakota, retail makes more than hospital, but the hospital is less retail than a retail pharmacy, so you have different aspects of it. But typically, hospital can be about $5 to $10 less than a retail pharmacy in any given state in North Dakota. You see that around a majority of the country, but you do see it in North Dakota pretty prevalently. So I'll count out a couple medications for you guys so you can see what they look like, see what we do. So this is our counting tray. It has, I'll show you how it works, but it has a place for the medication to go, and then a spatula, and then the actual medication itself. So some of the medications we do have are really fun color. Our goal is to obviously not touch it with our hands as much as possible. Sometimes it does happen. That's why we hand sanitize on a daily basis all the time. So we're just going to count the meds. Normally we count by 5. So there's 5, 10, 15, 20, 25, 30. And then this little nozzle makes the medications go back. And then this we'll put into our vial. Vials come in different sizes, so we can gauge it, and that's something that you learn as you go through. So there are lots of different sizes, and a couple of nice things about what we do here is they have both caps so that people can get easy off caps or regular caps. And then it's just trial and erroring until you know kind of what size they go in. A couple of different things about counting is, like, I count by 5s, but some people count by 2s. So then they'll just go through and they will count this all by 2s. Instead of 5s, there is no standard counting way that we do. It is all on your preference and how you want to do it. There are pharmacies that have counting machines, but here we just count most everything by hand because it's just easier. And if this was a controlled prescription, there's a whole bunch of other steps you have to take and how you count them and back count them and make sure that your inventory is on.